Hello, a very good evening to all of you. Okay, so in the previous session, we have just talked about how to select potency and repetition. So, in the previously, we were basically talked about how to select the potency because potency selection is a very much broad topic in itself. So we have dealt this in the previous session. Now we will talk about how to repeat the medicine. The repetition section, how to repeat the medicine. So obviously, uh, we have just learned in the previous session that trios of cure. What is trios of cure? While we are treating a patient, then the cure of that patient is particularly depend on the 3 point, that is, you know proper selection of the remedy, what is the exact simillimum of that patient, the proper selection of the potency. Now if we have selected the simillimum, then what should be the potency of that medicine, and the next, proper repetition, how we are going to repeat that medicine in different pathological indication, different disease, different age group. So basically, uh, in this session we will particularly talking about repetition of the dose, repetitions of the medicine. So we are going to deal in this session about repetitions of the dose. Now before going on the repetition of dose, we will discuss some very important point, that is, what is charge medicine and what is dry dose. Many homeopath, especially new homeopath, so much confused about dry dose and what is charge medicine. So charge medicine, this, if you are seeing this photo, basically this is a preparation of the charged medicine. Take. So now what is charged medicine? Basically how we are going to prepare the charged medicine. So for preparation of the charged medicine, we will take a 30 ml bottle of the glass. Basically if you see, this is the 30 ml glass bottle, but you can take 100 ml bottle also, or based on a 2 drum, half drum, charged medicine prepared on the personal need. So basically for the clinic purpose, we prepare the charged medicine in 30 ml bottle, glass bottle, in which the complete bottle is filled with small size globule, small sized globule. Now that size can be on your own choice, but mostly preferred that is zero size, or you can, zero size is also known as 10 number globule. So we will keep 10 number globule in the 30 ml glass bottle and fill that bottle with the potentized medicine, dilution medicine, that liquid dilution, and put the liquid dilution in such proportion that the all globules can be sufficiently get wet, sufficiently can be wet all the globules. We are going to take a 30 ml bottle, put 10 10 size or zero size globules in them, and fill a diluted liquid medicine so that all the globules can get sufficiently wet. Now in the clinic we can use these wet globules. These basically become dry in 1 month or 15 days. They become basically dry. Now keeping the medicine is such form is known as charged medicine. This is charged medicine. Now whenever we have selected the medicine that we have to give sulfur this patient, then it is said that take one or two globules, here, one or two globules from this charged medicine and put same 10 to 12 globules, that is non medicated globules, and give this medicine to the patient. This is known as the dry dose. We are not doing here water, we does not apply here the water. So how the charged medicine is prepared and what is dry dose? Basically, we put one or two globules that is medicated with some non-medicated globule and give the patient directly. That is also known as dry dose and charged medicine. Now, dispensing the medicine in this way has seen that it has the lowest form of aggravation. Now, it is also said that giving medicine can be by two methods, either in the globule form, that is charged medicine, or can also be dispensed in the liquid form. Like some doctors put directly one or two drop of the liquid dilution on the tongue. But that has a severe form of aggravation in some cases, not in all cases. Many doctors practice only on that method. So not every case get aggravation, but mostly some cases get aggravate by putting direct drop of medicine on the tongue. And even one drop is also so much heavy dose. One drop of medicine can wet approximately 300 globules. 300 globules, and in the dry dose we are giving one or two globules, and a drop of medicine can wet 300 globules. So obviously giving a drop is a higher medicine quantity. That is not the concept of minimum dose. We in homeopathy always talk about minimum dose. So that is not a minimum dose. So for minimum dose dispensing medicine, we usually medicine charged medicine use and dry dose in which one or two globules selected for dispensing the medicine. This is charged medicine concept. For those who are clinical purpose, I would like to tell that here will be the cap, white cap, and on the top of white cap you can write the name of the medicine like Broinia. So on the top you can write that Broinia 30, it will remain, and at the mirror, at the glass, there are stickers available which will be permanent. So with the same similar looking glass bottle, we will not confuse. So this is all about charged medicine and dry doses. Talking further, if we have talked about dry dose, then there should be some water dose or wet dose. Then what is that and how that is prepared basically? So now for preparation of the water dose, there can be two method. Can be either given in the dropper method or can be given in the glass bottle method. Now glass bottle quantity can be either 30 ml or 100 ml, but mostly 100 ml bottle is most preferable quantity. Most clinically preferable quantity is 100 ml bottle. Now if you are talking that we have selected the medicine, any medicine like phosphorus, we have selected the medicine, we have also confirmed that the case is acute and we have to give 200 potency repeated form in the water dose. Now we have clear up to now, but the problem is how we are going to give that water dose potency. So for that preparation we have to take a clean 100 ml glass bottle. In this, you can give the medicine in the two way. Either give some drop of direct dilution, you can put some drop of direct dilution in this bottle, or you can put one or two globules, that charged medicine. We have prepared the charged medicine. So from that charged medicine, one or two globules put in this 100 ml bottle, and put here clean water, purified water. Because if you are putting a non-purified water and the patient will use this medicine, then the chances of spoiling of that water is also. So always use purified water, always. And for the smell purpose, because if you are putting one or two globules and pure water, then its taste will be completely like a water. So for making like homeopathic medicine, we always put 10 to 20 drop of rectified spirit, liquid placebo. So that's the smell of that bottle will be completely like a pure homeopathic medicine. So for preparation of the water dose in a 100 ml bottle, we are going to put the water towards the neck. All the bottle will be filled with the purified water. Can be put one or two drop of medicine, even 10 drop, or some doctor also can be used, either drop form, or you can also use one to two globules of the charged medicine and put some rectified spirit for the smell purpose. This is the basic water dose. This is the method of preparation of the water dose. Now same process can be also used in the dropper method. Like we can fill the bottle till the neck with a purified water, put some drop of the medicine, or put some globules of the charged medicine, and with some rectified spirit, and we can repeat based on the need, either BD or TDS, or in acute case in a half hour, 2 hour, whatever will be the need. Then the repetitions of the medicine is very easily conversed with the water dose. So water dose can be done with the two method, that can be either 100 ml or bottles, or with dropper method. So both methods are equally benefited for the patient. Both are a very good method. In both way medicine can be dispensed. Now the third point, before we are going to talk about the experience of the doctors about the repetition, we will talk why we have to repeat the medicine. What are the causes when we have to repeat the medicine? What are the basic need? So basically, the need of repetition depends on particularly and solely three questions. In the follow-up, we always ask a three question to the patient, and the answer of the patient solely decide when we have to repeat the potency, when we have to repeat the medicine. The first question is, like suppose you have given medicine a patient, you have given a medicine to a patient, that may be either, suppose this is the broinia, or any medicine, sulfur, phosphorus, any medicine, and the patient is said that, yes doctor, I'm still improving, my complaints are still better. Then whenever there is the amelioration, or when there is a cure is in the progress, then at that point we don't repeat the medicine, we don't give the medicine at that point. Now if patient is improving, then does not repeat the medicine. The second condition can be that patient is now aggravated or going in the bad condition, worse condition. Like suppose for example, if you have given a potency of 30 of lycopodium medicine to a patient, suppose whatever be the complaint, we have prescribed lycopodium 30 potency, the patient get ameliorated, goes on betterment better, and then standstill cases, we have prescribed 200 potency, then he also start to improve slightly. But when their second standstill condition arise, we prescribe 1 m. Obviously we go ascend potency mostly to 30 200, now 1 m. But if 1 m does not change anything, or 1 m aggravate that thing, it probable mean is the medicine is not minimum. So if patient is improving, no need of repetition. If in the second case, if the patient is going to be bad or in the aggravation process, then the medicine is either our partial minimum, or we have to change the medicine, most probably the reason. And the third case, where the repetition is solely needed, that is standstill cases. Patient say, doctor, my itching was better, when we prescribed medicine 10 to 15 days, my itching was so much better. But now after eating medicine, taking medicine, I don't feel so much change in that itching, particular itching. So basically now, this is the standstill cases. At that point, need of repetition arise. Now, in acute cases, we will talk deeply in the repetition in the further slides. Basically, different doctors' experience, old homeopaths' experience about repetition. But before, we will talk some basic points. Now, in acute sudden emergency cases, repetition is basically, if extreme emergency cases, then there is the two chances. Either in acute we prescribe high potency single dose, or low potency repeated dose. So whenever there is acute cases, you have both options. But when you have acute emergency cases, both are different. Acute cases like whatever will be the problem, like coryza, sneezing. But whenever acute emergency, at that point we basically select low potency in the repeated form. And when there is not emergency, we have all the open options. This is a slightly idea about the repetition. Now a most important point we will talk, that what is single dose. Mostly doctors talk about single dose. What is the basic single dose, or what is accumulative single dose? So basically it has been seen, that the concept of single dose is very differently perceptible, very differently understood by many homeopaths. Basically think that single dose is only one time giving medicine, but that is not accurately. If we are giving on the repetition mode, like a patient come in our clinic, a child came in our clinic with so much weeping, and we are prescribing sina repeatedly in 4 hours, that is also a type of single dose. So basically single dose is the time in which we start the medicine and the reaction occurs. What will be the reaction after 10 days, 15 days, 12 days, 1 week? Like, we prescribe the medicine, then there will be some reaction, either the patient improve or get aggravate. So at between that time period, we whatever how many repetition have done, that is all known as accumulative single dose, a type of also a single dose. See, doesn't matter how many doses we have given to initiate the reaction, that is also known as accumulative single dose, or basically a single dose. Single dose is not just like, giving a single medicine at a single point, and repetition will be, a fatal or something, not single dose. That is also a single dose. So basically single dose is a number of also doses that needs to initiate a reaction in the patient. Now we all know how to give medicine in the adult, in the old, or in the children. But in the cases of infants, like if a patient comes in your clinic of basically 2 days, 10 days, 1 month, then that patient, cannot give globules directly, you cannot give dilution directly, because infants. So the method of dispensing medicine in infants is totally different. Now how we are repeat the medicine, or how we are going to give the medicine in the infant? So basically it is said that now suppose when we are taking the medicine by our tongue, basically because we take tongue, because they are very sensitive, very much nerves are there. So we apply the infants at that point, at that area where there are so much sensitivity, or so much nerves. So basically we rub the medicine. If you are giving the dilution, then we will put some dilution in the cotton and rub the medicine along with the nails of the hand or legs. That is equally affected as we give water dose or dry doses, equally effective. So while we are giving the medicine to the infant, we will rub the cotton, putting some dilutions of the medicine on the sensitive area, nails of the hand, sometimes also on the nose or lips. One more method used in the infants are, that is inhalation method. Inhalation method is putting some drops of the medicine on the cotton and inhale. So just you put that cotton in the front of the nostrils of the infant, they will inhale. That is olfaction method, and it is said that olfaction method is so much hyperactive, so much sudden action comparison to water dose or dry doses. But basically this is in acute. Inhalation method is most active in acute phases. Chronic can be also applied, but mostly in inhalation in acute. Now this inhalation method, or rubbing on the nails, both methods also apply to the hypersensitive patients. Many patients in our clinic comes that, doctor, after giving that medicine, whatever you give the medicine, whatever you give the potency, they will either start to prove, or so much aggravation from that medicine, because they are basically in hypersensitive stage. So for giving the medicine to hypersensitive patient, we prescribe, basically dispense the medicine by basically either inhalation method or by putting the medicine on the nails. That is also very beautiful medicine, very beautiful method. So now we are going to talk about many old homeopaths experience, how they have talked about the repetition. So before that, we would like to commence a point that we are going to organize a 10-day case taking session. We will solely talk about in that session about case taking, deep knowledge about case taking. How we are going to take acute case taking, how we are chronic case taking of mental disease. We cannot apply the same method to all the patients, all the cases. So case taking of mental disease, case taking of one sided disease, sometimes many case needs different type of case taking also. So basically this will be a 10-day session on Zoom, basically on the 9 p.m. onwards, and all the recordings will be given in the group for lifetime. So those who are interested can message at this number. So now we are going to talk the method, the concepts of repetition told by our old doctors. Many methods have been told that either beneficial so much for our clinical purpose. Now putting the concept, the experience of the great homeopath, that is Dr. P. Sankaran sir. He is the father of Dr. Rajan Sankaran sir. So now what were the method used by Dr. P. Sankaran sir? He usually put a single or two globules in 100 ml water, or they make basically water dose, and if he have to give a single dose, single time, only one time medicine, then he put 1 spoon and give the patient and watch till any type of reaction. Now what Sankaran sir do? He make water dose and put 1 spoon and give the patient and wait till the reaction. Now reaction can be whatever, either aggravation and emulsion, but he wait till that point. And if further repetition needed, then he start to dispense same the medicine in the water dose in the repeated form. So basically Sankaran sir used water method with one dose given like 1 spoon. Now Dr. Sankaran sir said that if the patient is improving, cure is going on, improvement is going on, then at that point please and please don't repeat the dose, because it has chances of the aggravation, so much chances of the aggravation. But you know, here with some doctors we are not going to say that what is right and what is wrong. In this particular section we will only talk about what our old homeopath has taught us. So Dr. P Sankaran sir has seen that in many cases he give water dose to their patient and said that if any type of reaction occurs, that can be either aggravation or amelioration, then suddenly stop this medicine and come to me and tell what is the result. And he seen, he say an examination, or he go to conclusion that those patient who stopped, who followed Dr. Sankaran sir, that after any reaction he stopped the medicine, he get improvement with not so much satisfaction, not so much satisfactory reaction. But those patient, basically we are talking in the acute phase, this is the acute phase, but those patient who taken continued medicine after any amelioration or aggravation, like suppose if the patient uh, of severe coryza, Dr. Sankaran sir advised take allium cepa. He given allium cepa water dose and given to the patient and said that if you feel ameliorated or aggravated any type of reaction, then suddenly stop the medicine. So those patient who stopped the medicine, according to Sankaran sir, he take more time to be cured. And those patient who does not follow Sankaran sir, who does not stop the medicine and even continued his taking medicine even after the cure, even after the amelioration, he feel more better and without any aggravation. So from this experiment, from these point, Dr. Sankaran sir has concluded that in acute phases you can repeat the medicine even after the improvement has started. Like in chronic we always talk, if there is improvement but don't repeat the medicine, then don't repeat the medicine. But Dr. Sankaran sir has clearly said in acute phase, if there is a start of improvement, still you can continue with your medicine. And in this particular point, even the patient feel great improvement and very in short period. So according to Sankaran sir, take the homeopathic medicine in acute phase until you get totally cured, until you get totally cured. So this is the particular experience in the acute phases, this is talk about acute phase, not in the chronic. Now Dr. Sankaran sir has said the repetition basically depends on the simillimum. If you are so much close to the simillimum, then the need of repetition is so much less, then there is not so much need of repetition. If you are too much close with the simillimum, that yeah, this patient is exactly the pulsatilla, so at that point repetition, need of repetition is basically highly decreased. This is method done by Dr. Boger sir, who are a very great homeopath, very easily can find the simillimum. So those who get Dr. Cancer, like those doctor who get easily simillimum, they less repeat their medicine. So basically from this point we can also say that repetition is needed when we are not sure short about our simillimum, that this patient can also be natramure or probably sepia, so at that point you can repeat your medicine. Now repetition is basically can be two method. Giving the medicine can be in the two method, either give low potency till improvement, this is all idea about Dr. Sankaran sir, nothing has been added. So it is said that you can give low potency till the improvement and when improvement start, stop the medicine. Or the second point, give high potency and keep the patient on the placebo until need of any change. If any change start, then that is the favorable. This is all idea about Dr. Sankaran sir. Now talking on the second doctor, the great homeopath, Dr. J.N. Kanjilal sir. The experience of Dr. Kanjilal sir is so much great. He was so great doctor that he is very easily can find the simillimum. So all those doctor who are very much sure about their simillimum that yeah, this is the accurate medicine. So basically they prescribe single dose, because as you are close, as you are sure about the simillimum, the chances of repetition is so much less. Dr. Jain Kanjilal sir also said that in the period of cure, basically you don't need more than 2 or 3 doses if you are accurate simillimum medicine. And this is obviously seen by our also clinical experiences, that if you are surely thought that this is the exact simillimum medicine, then need of repetition or need of more dosage is very less needed. Mostly 2 or 3 doses of a single medicine is enough to cure a disease if the medicine is exact simillimum. See, this is slightly confidential about Dr. Jain Kanjilal sir. See, a great idea, a different idea. Now, if you are talking on the repetition section of Dr. Herring sir, then Dr. Herring sir basically used to repeat the medicine in the gap of either 2 day or 4 day or 7 day till any reaction. Dr. Herring sir basically trust in the repetitions of the dose. So he used to repeat the medicine with a confirmed interval. It can be either interval of 2 day, either interval of 4 day or 7 day, a fixed interval repetition till any reaction has been started. Whenever the reaction has started, they stop the giving medicine and keep the patient on the placebo. This was a solely method of Dr. Herring sir. This is the only method. Now if we move on our next great homeopath, Dr. Lippe sir. Now Dr. Lippe sir basically also trust on the repetitions of the dose. So whatever they do, that they give low potency repeated in 2 hours. Whatever the state of chronic disease, Dr. Lippe sir what do, that he selected the medicine and repeat the medicine in every 2 hours till initiation of any reaction. Whenever the reaction start, Dr. Lippe sir stop the medicine. These methods also used by our previous doctors which we have talked. Everybody prescribe the medicine till the initiation of the reaction. Whatever the medicine, either in the 2 hours, either in the 2, 4 or 7 day or BD or TDS, whatever will be the method of repetition, but every doctor stop the medicine when there is initiations of the reaction. When there is a reaction has start, they basically stop the medicine. Now Dr. Lippe sir also said similarly, as we have talked previous, that single dose is basically an ideal dose. Those doctor who prescribed basically a single dose having so much confidence about their choice of the simillimum. So basically single dose is ideal dose. So prescribe a single dose when you are sure about your simillimum. Now in children's, basically when we are talk about children, then the comparison, if we take a data analysis or compare, the chances of improvement of children is so much better, so much in comparison to adult and old. Now this criteria is because the children are basically pure, their symptoms are basically pure, they does not mix their symptoms, they have not taken so many medicines. If a adult came in your clinic, he will say, yes doctor, I have taken the medicine from Ayurveda also, allopathy also, Unani also. He have usually obviously done many mixed medicine. or he has obviously taken very mad medicine. He is not at pure at that time, but children's which come in clinic, they are basically pure. So according to Lippe sir, the chances of improvement cure of the children is far more better than the adult and old. Now if we see the home experience of these homeopath, then everyone has tell that stop the medicine when there is initiation of any reaction. Initiation, like body has start to act. That can initiation can be like aggravation or amelioration, whatever be the reaction. At that point, stop the medicine and keep on the placebo. See, every doctor follow this method. Whatever the frequency of the repetition, that doesn't matter everywhere, but everyone stop the medicine when there is start of reaction. Now we will talk some more doctors having some exact idea about some pathological case, how to repeat in some type of pathological case. So Dr. CM Bogar sir, a great homeopath, has taught about that in my clinical experience. See what a great idea has given by Dr. Bogar sir. He had said, Dr. Bogar sir had said that in my clinical experience, those diseases which are recurrent in nature. Now what disease can be recurrent? Malaria, typhoid. So he said that in such cases I have not found so much cure with a single dose. So according to Dr. Bogar sir, whenever there is a recurrent disease, that can be malaria or typhoid, in such cases you have to repeat the medicine. In such cases repetition is needed. So we can also apply this idea in our clinic. That we can use or we can repeat the medicine in such recurrent diseases, that can be either malaria or either can be typhoid. If the disease is very much quick in action, like uh, a patient come in our clinic and he get coryza in the noon, and in evening he said, doctor, I have now so much severe suffocation, now I have shortness of breath. See how the disease is so much sharp in nature, quick in nature, that within some time the patient had start to suffocate. So if according to Dr. Bogar sir, if the disease is so much sharp and quick in nature, then the medicine which has been chosen should also be very much fast, and the repetition in that cases should also be so much fast, and the cure, the benefit in such cases should also be fast. All the reaction will be according to disease portion. Now see, if the disease is so much sharp, so much quick, like if a patient get a tumor in the neck area, in 2 or 3 days he becomes so much painful, and 4 or 5 days he becomes start to separate. Usually tumors does not separate so easily. So in that case, the reaction of disease is so much fast. So at that point you have to choose that medicine which is should be so much fast. Like at that point slow medicine cannot be selected. Now if disease is fast, then we have to repeat the medicine so much frequently, and if the disease is fast, then the cure, the improvement also should be so much fast. Now according to Dr. Bogar sir, slow pathology, he what he used to do in the slow pathology, basically he give high single dose and wait for reaction, keep the patient on the placebo. Now what is slow pathological disease? Like rheumatoid arthritis, vitiligo, these are slow pathological things. In these things Dr. Bogar sir give a high potency of a single dose and keep on the placebo, because now If you compare both statement, that if the disease is so much quick, so much sharp, repetition should be sharp. But if the pathology is slow, then also there will be slow improvement. Like if the rheumatoid arthritis does not form in 2 or 3 days, it takes months, years. So obviously there will be improvement also takes time. So many times you can console the patient by whatever the duration will be depend on what type of disease. Now to avoid aggravation, like many points we have given 10m and many patient complain of aggravation. So to avoid aggravation, we have talked in our previous session that many doctors have advised giving 3 doses in the gap of 2 hours, mostly reduce the chance of aggravation. So these were the idea of Dr. Boger sir. Now we will talk the idea of a different doctor, Dr. Campbell sir. Now every doctors have now some different idea, some different opinion. So Dr. Campbell sir has said that old people need many doses of medicine to cure, to complete the cure. Dr. Campbell sir has find in their clinical experience that old patients basically need very much repetitions comparing to children's and adult. Now why? Obviously there would be some reason. So basically old people have low vitality. Because of that vitality, because of that low vitality, the patient need many high doses to complete the cure. Now, Dr. Campbell sir also talked about pathological indication when we solely prescribed on the pathology, like a patient come in our clinic with the cancer of the stomach. Obviously, that cancer has so much pain, so much, and if we are prescribing on that particular point, like that, if you talk on pathological, then cancer have severe affection of a Condurango medicine. So if you are prescribing Condurango at that pathological indication, then at that point we have to repeat the medicines. We cannot just keep a single dose and keep the patient on the placebo. No, whenever we are prescribed on the pathological indication, then there is the need of repetition. This was the experience of Dr. Campbell sir. Now we will talk the experience of Dr. Cooper sir. Dr. Cooper sir has clear cut idea about simillimum. Here so much great idea, he can easily catch the simillimum. So all those doctors who are sure, who are so much confidence about their simillimum, they usually less prescribe, less repeat their medicine. So Dr. Cooper sir also never give a repeated medicine. He was a so great doctor that if he's you know exact about their simillimum, then he used to prescribe a single dose of mother tincture also. See, a very much different unknown idea. Single dose of mother tincture. Dr. Cooper sir has many times prescribed single dose of mother tincture in cancer patient. So Dr. Cooper sir always gave a single dose that can be either potentized or either mother tincture. And Dr. Cooper sir also told that he basically avoid high potency repetitions in sensitive patient, because if the patient is sensitive, he will easily start to prove that medicine. The proving will be so much easily in that patient. So whenever your patient is so much sensitive or hypersensitive, does not repeat the medicine, does not so much repeat the medicine. Now we have talked many doctors experience and mostly have approximately similar idea. Now we are talking about Dr. Jordan sir, a different idea, a different type of repetition. Mostly doctor does not aware about this. So much different type. Now Dr. Jordan sir has basically give you know he trust on double dose and sometimes triple dose. See, we are obviously many time prejudiced. No, we have to give single dose, we have to give only this potency, we have to give only that potency, and that is also a type of prejudice. If we talk about different doctors, they have so much type of experiment. We can try this type of their experience in our clinic. Dr. Jordan sir has said that in the chronic cases, what he used to do for experiment purpose, he used to do two potency of the same medicine in the alternate of either 1 day or 2 day, either in the alternation of 24 hour or 48 hour. This is a very different idea. What he do, that if he has selected that natrum sulf is the basic constitution, basic simillimum of that patient, then he used to do natrum sulf 200 single potency at that point, and after 24 hour or after 48 hour, he give natrum sulf 1 m potency, see the next potency, in immediate 1 or 2 days. And he said that those cases who have failed with a single dose give us so much enormous, so much satisfactory result with these type of double dose. See, this is also very much different idea. If we are treating a patient and we are sure about our minimum and that does not act, then we can also try in some cases that is double dose. Or Dr. Jordan also said that if the cases of the neurasthenia or nerve related problem, then we can also use triple dose, successive triple dose, that like uh, 30 200 1 m in gap of 24 hour, or 200 1 m 10 m in the gap of 24 or 48 hour, successive potency. See, this is a typically a different idea from our other homeopaths. Now, at this point, you cannot say that Dr. Jordan sir is right or wrong. This is particularly his own experience. Now, what we can do, that we can analyze these points in our clinic. We can experiment with these points in our clinic. If get benefit, then continue. We can trial these things. So, doctor summarize. If you summarize Dr. Jordan sir's idea, so those patients who become fail to give result with a single dose, in that type of patient we can try double or triple dose, that is successive dose, in 1 or 2 days gap. But these things should not be tried those patients who have low vitality, like in old peoples or so much severe chronic disease, because their vitality is so much low, and if you prescribe, if you increase the potency so frequently, that there can be chances of aggravation. So don't follow the double dose or triple dose medicine in the patient having low vitality. This is the idea of different idea of Dr. Jordan sir. Now, moving further, if we talk about Dr. S.R. Phatak sir, S.R. Phatak sir's experience, then he also usually so much sure about their selection of the simillimum, and basically what he do, he also repeat the dose, and when there is any reaction, then he stop the repetition. This is approximately same idea as different doctor has said, but he has taught us something different. Like if we read the materia medica or the cases of our old homeopath, basically we often see that he prescribed a single dose of that medicine, and the medicine going to be act for months of months, 4 months, 6 months, 8 months. But those are doctors who sit in the clinic, see the patient, they can relate this point, that this is not in this type of era. We cannot give a single potency and the patient say that yeah, I'm good for 6 months. Obviously some patients have occurs, some patients have seen these type of result, but mostly have need of frequent repetition either in 1 month, or single potency exhaust in 1 or 2 month. But in the previous times, medicine's action lasts for 4 months, 6 months. Now difference in both type of the duration of the action is basically because of changes of the medicine. At older time, at that time, mostly doctors prepare their medicine from own. Now we are totally depend on the pharma companies. So basically the change of quality of the medicine is also important, and many changes have occurred, that food habitat, pesticides, atmospheres, behavior, environment, basically many things has become resistant in homeopath, make body some type of residency, so the body, the action of medicine cannot go even for 6 months. They basically exhaust in 1 or 2 months most of the cases. Exception is always there, that can be exhaust in 1 week also, that can go for years also, but mostly the exhaustion is approximately 1 or 2 months. So Dr. SR Phatak sir has basically given the reason of this point. Now Dr. Ross sir has given a different idea, a different point. He said that if in the body there is high ESR, if high ESR, then it is indicated of continued active infection in your body. So according to Dr. Ross sir, if there is continued high ESR, if you have the patient's pathological report and there is the continued high ESR, then at that point you need to repeat the medicine. Repeated medicine should be given. That can be either case of the malaria, either case of the dengue, either case of typhoid or fever. And the changes of potency should also be frequent. So in this type of patient, we give water dose with every next dose with the 10 succession. When we give 10 stroke, the chance of medicine, the potency of medicine slightly change. So according to Dr. Ross sir, when we are giving a medicine, seeing a disease with a high SR, then obviously we are going to repeat the medicine and every potency should be changed. So basically the water dose given with the 10 stroke, every dose we will the patient will take a 10 stroke before every dose, so it will increase the potency slightly. This is so the different idea about Dr. Ross sir. Now how we can apply this in our clinic? Suppose a patient in the comes in our clinic with fever from the long time, having high SR, and we have prescribed a single dose, so and the patient is not improving good, so from that point we can use the idea of Dr. Ross sir. Last part of experiences of the doctor, we are talking about Dr. Quinton sir's experience. Now what he has done, that same as Dr. Ross sir has said, same idea is about Dr. Quinton sir also. He said that in high fever, in the cases of fever or continued fever or chronic fever, Dr. Quinton sir usually repeat the 30 potency medicine daily. So potency is basically his choice, but what we can learn from here, that the repetitions. Dr. Quinton sir are also same idea, that in the cases of high fever, the chance of repetition is increased. Now as you are going to the highest potency, then the chances of need of repetition also decrease. Now this is all ideas about different homeopaths about the repetition, and mostly all the doctors talk about the same thing, that give your medicine repetition form until there is the start of any type of reaction, and when there is start of reaction, then at that point stop the medicine. Now till now we have seen the different aspect of selection of the potency and selection of the repetition, but a simple idea, that if your medicine is minimum, then whatever the potency, whatever the repetition, the patient will be get benefited. Doesn't matter what the potency you choose, and if you have not repeated, then also the patient will be get benefited. But the speed of recovery can be different from selection of the different potency and proper right repetition. So need of such thing about total potency and about repetition basically increase the cure rate easily and fast way. So this is all about the experience of different homeopaths, great homeopath. Now next point, we are moving further on the conclusion. We have talked about different doctors homeopath, very great homeopath. Now if you are talking about the conclusion, then conclusion, some points, some tentative points in the repetition field, that if the speed of disease is so much high, if the speed of disease is so much high, then repetition should be so much quickly repeating. But it is said that suppose a psychological acute case, that can be either mania, either shock, mentally affected, and you are prescribing aconite, then in organ, Dr. Honeyman sir had said that the need of aconite repetition is not. You don't have to repeat the aconite. The action of aconite is so much severe and fast that a single dose of aconite is sufficient to cure the disease, to ameliorate that point. So if you are talking particularly about aconite in the psychological cases, acute psychological cases, then there is no need of repetition. This is a basically exception. So while we are prescribing aconite in acute psychological cases, we don't need to repeat, because the disease will be also fast and aconite is also so much fast medicine. So the chances of cure is so much fast, and the cure, then there is no need of repeat the medicine. Now repetition, if you are talking, then we will talk some a different point. Like suppose a patient in your clinic comes, doctor, I have hypothyroid and no any other complaint. Then you don't have any point when we have to change the medicine, or second prescribed medicine, second prescription, or hot to repeat medicine. So in that portion, in that up point of view, in which the disease will take more time, like suppose talking about rheumatoid arthritis, patient come in our clinic and we know that the rheumatoid arthritis is not going to be ameliorated in 10 days, 15 days, or 1 month. Then at that point, in such type of disease, how we are going to understand that either our medicine is right or wrong? Or talking about vitiligo case, a patient of vitiligo came that, doctor, I am suffering from vitiligo from 10 years. We have given the medicine for 2 months. Now how we are going to sure at these type of disease that is our medicine is right or wrong? Because these type of pathological change will take time. So at that point we will ask some other questions to confirm our medicine. The first thing, we talk about their sleep. If the medicine is similimum, the medicine is right, then their sleep will be changed. He will feel a better sleep. Different thing is energy. After giving a similimum, the energy level of the patient will be so much good. Now suppose a case of vitiligo came, that then chances of cure of vitiligo will be taken time. But if the patient say that, doctor, from whenever I have taken medicine, I am feeling energetic, mentally so much good, but the disease is same as it were, then you are sure that your medicine is right. These type of point confirm your similimum. Thirst level, concentration of work. If the patient says that now my thirst has improved, or concentration on the work was so much bad on the previous, but now it has been good. Bowel movements, doctor, before medicine I was constipated mostly, but from when I am start to taking medicine, then my bowels are regularly clearing. So these points, some points are basic hint about that your medicine is right. You have given a right medicine. Now, talking about the repetition in the acute phase, Dr. Bogar sir, see a great homeopath. Dr. Bogar sir also gave a single dose in acute cases also. Dr. Bogar sir gave single dose in acute cases also because he is so much confirmed about the minimum. So in acute cases, you can also prescribe a single dose, but when you are so much accurate about your minimum. So whenever you are sure about minimum, you can prescribe a single dose in also acute cases. But when you are not confirmed, not sure about your minimum, then at that point you have to repeat the medicine. Why? Because many times at the repetition, due to the repetition, patient also palliate either with some sphere of action of that medicine. Like if the patient constitution whatever, if you are prescribing a patient having so much gas distension and constipation and giving the lycopodium that medicine, that patient whatever will be the constitution, but patient will get slightly ameliorated because the chief sphere of action of the lycopodium is that part. So in acute cases, we usually frequently repeat, because if not we are going to be minimum, then also from the patient will can be better from that sphere of action. Now a different aspect we will talk, that mostly doctors talked about a single dose. Mostly doctor does not repeat the medicine, but if we are open and read in the sixth edition, then Dr. Hahnemann sir, the great Dr. Hahnemann sir, has clearly mentioned about repetitions of the doses. Clearly mentioned Dr. Hahnemann sir that in chronic disease we can frequently repeat the dosage. But while we are talking with the most doctor, they are confirmed about single dose, not repeating the dose. Why so much, dissatisfaction with these points? That even if Dr. Hanuman sir has talked about repetition, then why many homeopath, does not repeat the medicine? So the conflict was between the editions of the organon. The fifth edition of the organon was, and the sixth organ, the difference between both the organ is basically 88 year. So the all the great homeopath who have practiced basically follow the fifth edition of the organon. They doesn't follow the sixth edition, because all the great homeopath were the era of in the fifth edition, and sixth edition obviously came recently after 88 years. So most tentative rules were made with the help of fifth edition. So this is basically the you know conflicts. These type of repetitions conflict arise with these type. So you can also prescribe single dose, you can also prescribe repetitions of the dose, basically depend on the need of the patient. Now some experiences about potency selection and repetition. This is a point I have seen in many cases of our bone complaint. Like if a patient is suffering from any type of bone complaint, that can be either arthritis, rheumatoid arthritis, gout, and you are a single dose prescriber. Then suppose if a patient of arthritis came in your clinic, then I have prescribed sulfur 200. The patient complained, doctor, I am not getting better. After prescribing sulfur 1 m, a higher potency, patient starts improving so much, so fast way. So from the experiment of many patients, it has been seen that in the bone complaint, particularly talking about arthritis, rheumatoid arthritis, gout, those complaints who solely affect the bone, in that point high potency have higher result comparison to low potency. But suppose if you are going to prescribe a high potency, then there can be also chance of aggravation. So there can be two methods: either give high potency in the 3 dose, or first give a low potency. Many times what I do, make susceptible to patient. So mostly what I do in my clinic, that give a 200 single potency, and if the any reaction start, then we stop. We doesn't repeat the medicine. But if no reaction occur, then in the next week we give a higher dose of that potency, and many times patient get so much improvement. See, this is the Dr. Jordan sir's idea, double dose. But what we have done, the chance, the repetitions day has been increased. Dr. Jordan sir prescribe double dose within 24 hour or 48 hour, but we prescribe in 1 week. You can follow this thing in your clinic, and obviously trust me, you will get a great result in the bone arthritis, rheumatoid arthritis cases. So that bone complaint basically give a good reaction with high potencies. Dr. Vijaykar sir also has clearly mentioned that all type of autoimmune disease need a higher potency, like rheumatoid arthritis, psoriasis, vitiligo. But those disease which have chances of aggravation, like if a patient of psoriasis come in your clinic and you give directly sulfur 10 then chances of so much aggravation. So what we have to do, that for these patient we have to make the susceptible. So firstly we will give one dose, 1 or 200. When the exhaust that potency, then we does not repeat the same potency, we go on the next. Like in psoriasis we have prescribed natramur 1 the action of natramur 1 goes for 1 week, 10 days, 1 month. Then if we prescribe next, then we will give 10 higher potency should be preferably given. But if we see in the vitiligo cases, then there is a no chance of aggravation. There can be not any itching, not mostly pains, nothing. So in the vitiligo cases you can directly prescribe 10 or 50 and trust me, having great result. Now the third point about the potency and repetition is, higher potency should be used in the physiological problem. All the problem having physiological complaint, gastritis, arthritis. See, arthritis is also physiological complaint. That's why it needs higher potency. But if the problem is pathological, lower potency. In pathological problems, basically the patient have low vitality, so low potency in the repeated form should be given. Now all the psychological case, suicidal depression, mania, delirium, all the psychological cases need higher potency. Higher potency should be given in all psychological cases, except there is a great exception. If we talk about suicidal cases and our medicine is whatever, that can be either natrum, sulfur, whatever be the medicine, then try to be safe by giving high potency. Does not give a high potency medicine in suicidal cases, because suppose whatever the problem, many times there is a chances of aggravation. But if in the cases of suicidal the chance of aggravate increase, then aggravation in their suicidal thoughts will be occur, and that patient have mostly chance of suicide. This were dealt by many homeopaths, that many cases of suicidal cases have came and he have selected the right medicine. Suppose a patient in your clinic comes and you have selected clear cut case, this patient is totally similar to Aurum-met, and if you are giving Aurum-met 10 or high potency, then many time has been seen that their suicidal thought has been increased, aggravated for some time, and patient has been done suicidal and he is dead. So basically particularly talking on the suicidal cases, try to not give high potency, or if you are giving high potency, then strictly advise their attendant or their family member to remain 24 hours with the patient for at least 3 to 4 days, because chances of aggravation will be diminished in 3 to 4 days. So strictly advise their attendant or their family member to present with the patient for minimum 3 to 4 days. Now, on the repetition phase, it has been seen that all the animal remedies should not be repeated so much frequently. Animal remedy like laxative, sepia, it has been seen that this is also similarly for acute cases. Like if the acute phase is sepia or laxative, then at that point you should give a high potency single dose and leave the patient on the placebo, because it is said, and I have also verified this point in our clinical experience many times, that repeating the animal medicine, the medicine whose source is animal, like sepia, laxative, crotalus horridus, these type of medicine get so much severe aggravation. So try to vomit the repetition of animal remedy, does not repeat the animal remedy. The action of nosodes and sarcodes have so much great action in higher potencies, that is 1 m or 10 m. Obviously many doctors will have results in low potency 30 or 200 also, but if we're talking about mostly, then the sphere of action of the nosodes and sarcodes has been seen with the higher potencies. The metal should not be repeated so much oftenly. Like if you have selected the medicine like alumina, cuprum met, plumbum metallicum, then probably try to vomit the repetitions of that metals, because metals have mostly sphere of action on the paralysis. All the metals are a very good medicine in the cases of the paralysis, and suppose if your patient start to prove the medicine, then the chance of the paralysis will be so much increased. So try to avoid the repetitions of the animal remedy and metals. Now all the rare remedy mostly which we use in our clinic, that is used solely in the low potency. Rare medicine have so much great action in our lower potencies. Now selection of the medicine is, if you are sure about selection that yeah, this patient is totally this patient is totally crotalus horridus, then you can rely on one potency and wait for that. Many doctors has been came in our era, and many doctor like Dr. Cancer has given a single potency and wait for the action of that potency for so much week, 2 weeks, 4 week, 1 month, even 2 month. Many doctor has wait for the action of medicine for 2 months, because they are so much sure about the selection of the potency, selection of the medicine. So if you are sure about selection of potency, selection of medicine, then try to wait, does not repeat so much hurried. Now repetition also depends on pathology. If the pathology is so much fast, the repetition should be so much fast. In many cases, in many pathological cases, repetition has been done within the gap of 10 to 15 minutes. Within gap of 1 hour also repetition has been done. So repetition's speed is also depend on the speed of pathology. Now we have talked a very much different ideas of the repetition, that is either single dose, either repeated for 1 week or repeated for in 1 week 10 days, or double potency. See different ideas. And what we were till now, that we have to give a single dose, we were fixed till now. Many were giving repeated only or giving single. So all these being fixed either about your potency, either about your repetition, these are basically being prejudiced. So if you are going to deal, if you are going to talk about different homeopath, going to understand the literature of different homeopath, then the prejudiciation will be so much decreased. Never be prejudiced that I have to give single dose, I have to give many doses. No, don't become prejudiced. See the case and do whatever at that point you want. So basically this is all about the repetition and potency selection. We have done in the previous section that the potency selection and repetitions of the dose. So we have completed our 2 days session. Further, if have any query, he can freely ask or comment section, we will reply there. So this is all about potency selection and their repetition. So thank you everyone.